Welcome to Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Welcome to Doc Discussions. I'm Jason Edwards, and this is the world's best medical podcast, in my opinion. I'm here with my good friend, Dr. Scott Geiger. Scott's a plastic surgeon here at St. Luke's. Scott, how you doing, buddy?
Hey, doing wonderful. Thanks for having me on today. Appreciate it, Jay.
You bet, man. You bet. Now, kind of take me from the start. Where are you from originally?
Oh, gosh, yes. So originally born out in Arizona, so born and raised Arizona, moved over to kind of small town Illinois for a little bit, did all my training here in St. Louis. I was a SLU guy, so down in St. Louis U, SLU undergrad, SLU med school. Yeah. Then I decided to join the Navy and go do some cool, fun stuff, which was phenomenal. So joined the Navy. They paid for my medical school. And then
where were you stationed at?
I was first. I started off in San Diego. So Naval Medical Center, San Diego's out there, largest naval medical facility in the world. It is phenomenal.
Is that Balboa?
Balboa, you got it. Yeah,
good.
And did my surgery intern there, and then I decided to go do some adventurous stuff. So I went to flight school and learned to fly jets and helicopters and aerospace medicine, a lot about safety and aviation and personal factors, all that sort of stuff. And
really? That's in Pensacola? Is that where the Navy does their...
That was in Pensacola, correct? Yeah. So good. Home of the Blue Angels.
Yeah.
Down in Pensacola. So a little stint down there. And then...
So did you fly? Were you a pilot?
We did. So I was not a pilot, but we had flight time. So we got to learn to fly the fixed wing, your regular airplanes and jets, and then we get to learn to fly rotaries, the helicopters.
Yeah.
Kind of a half a syllabus for both, so we can understand what the pilots go through, all their stressors, and what it's like to do that in those situations. Kind of get in their head, because our job was to keep the pilots safe, make sure they were safe to fly, and the air crew and all that stuff. So
so
we got a lot of flight time, flew a lot of cool aircraft.
Did you ever break the speed of sound?
Yes, absolutely. F-18,
how was it?
I don't quite know. I mean, you do your little thing, and I'm gonna say everything was awesome in it. The pulling the G's, back of an F-18, on and off aircraft carrier, the helicopter stuff was phenomenal. It's everything. Yeah. It's like every little kid's dream, man. Yeah. It was great.
And did you have a mustache at the time, or were you just clean shaven?
No mustache. You had to be clean shaven. This was during, all the Iraq, Fallujah wars, all that sort of stuff.
Okay.
So there's always
all business.
Everybody's got to be kind of clean shaven in case there's gas mask stuff. I mean, even though we were in the States, but
you got to be
keeping it clean.
That's amazing, man.
Yeah. Cool.
Well, thank you for your service to our country, for sure.
Absolutely.
And so, did you have the glasses? Did you have the?
Oh, absolutely. We got official Navy issued aviator glasses.
Very
for
good.
Sure. Yes,
Very
and
good.
The jacket, the bomber jacket too, man. Yes.
And so you found your way to St. Luke's here in Chesterfield, Missouri.
You got it. Yes.
Yeah. And so plastic surgery kind of covers a lot of things. And for the people who don't know, I mean, it's very hard to become a plastic surgeon. They only take the very best of the best. And I know a few people who actually trained with you, and that's what they said. And that's been my experience too. You and I interact with patients who have breast cancer when you do reconstructions, and you do a wonderful job. And
thank you.
I think it's so important for the patient's mental health to get that optimal cosmetic outcome. Yeah. But what other procedures do you do? What are the common procedures you do?
Well, kind of like you mentioned too, plastic surgery is super broad. It's basically head to toe cancer, trauma, and cosmetic reconstruction. So basically we go everywhere. We can be up in the head and rearranging the skull for a cranial vault remodeling, to facelift, neck lift, nose jobs, ears, down to the breasts, all the belly stuff, massive weight loss patients, a lot of excess skin, thighs, arms, lower extremity reconstruction, traumatic accident. The orthopedic surgeons have to, do all their work and get plates and screws. And sometimes we need to move muscles around the body to kind of help cover that so things can heal.
Yeah.
Same thing in the chest. Someone has a heart surgery and they have some wound problems because that's pretty intense stuff, and they can get pretty sick. And sometimes we got to come in and help out and cover the heart and make sure we can help things move along and get them healed up. So
get some good closure.
Pretty neat. Yeah.
And actually we treat keloids sometimes too. If patients have a lot of scar tissue, they excise it and treat it.
Over aggressive scarring. Yeah, that's right.
Yeah. And so Which procedures would you say like are your three most common procedures that you do?
Absolutely. So without a doubt, my top two is going to be, breast lifts and reductions, let's say. So shrinking up the size of the breast, a little more perky, managing, excess weight, back, neck, shoulder pain, all that sort of stuff. And then tummy tucks, any kind of the body contouring. Yeah. So we work a lot with the bariatric surgeons, down at DePere and all around town. People, Ozempic craze going on right now, which is phenomenal. Everybody losing all that weight.
Yeah.
Well, you're left with a lot of skin afterwards, and that's not fun. You want to kind of show those results that you've worked so hard for. So we take off a lot of skin. So that's probably number two.
Yeah.
And then probably breast cancer reconstruction is probably my third most common thing. Yeah.
A couple things. Breast reductions cosmetically look great. I mean, I think that's one thing people probably may not realize. And the other thing I will say is, with my experience in patients who've had cosmetic surgery, I think if they feel better about their way they look, that kind of bleeds into other parts of their lives where they start eating a little bit better because they say, you know what, I'm looking better. Maybe I will take care of, and it kind of has this ripple effect that I always see. But I think patients don't anticipate. Have you had some experience with that?
You nailed it. It is something like a breast reduction is the patient satisfaction is through the roof. It's like 97, 98% satisfaction. They're so happy. We hear all the time, man, you changed my life. I got my life back.
Yeah.
I didn't realize I was in pain all the time.
And this isn't hyperbole. I mean, I've seen it with my own eyes. It's because if you have really large breasts, it makes you look like you're overweight.
Correct. Yeah.
And so, but people start buying clothes and that fit a little bit better, and it just has an outsized impact. I think. Yeah.
Well, and like you said, with the health stuff, when the breast gets smaller, you may notice your belly a little bit more or something, and you say, well, I'm going to continue to eat a little bit better. It has a whole bunch of downstream, just positive effects. It's great.
Yeah. I'm reading this book called Happiness Hypothesis by Dr. Jonathan Haidt, and he's written a couple books that I thought were pretty good. But one of the things that it wasn't him, other people have shown, but he references in the book that it's actually hard to spend money on things that make your life better. You will be happy in the short term, but then you kind of go back to your set point of happiness, whether it's 7 out of 10 or whatever. Yeah. Plastic surgery is actually one thing that they found scientifically that you can spend money on that actually makes your life better in the long run for reasons like that.
I think I see that every day, but I haven't seen it put, pen to paper. That's good.
Yeah, it's good to have some validation. Yeah. I just heard, I was driving to work, listening to the book on tape when I heard that, and I just laughed. I said, I'll buy that.
Yeah. I think that is probably what, everybody wants job satisfaction and make sure you're doing the right thing. And I think it's really easy for my particular job to every day, it's high fives. I feel great. I look great. I feel so much better. You changed my life. It's positive. And that's a great reinforcement. And it just makes us love what we do and want to do it more and help everybody, Yeah. And, there's certain stuff you deal with a lot with cancers, and you have a lot more of, you're saving lives, but there's a lot more sad moments, and that's tough.
No doubt.
I'm fortunate to be a little more on the positive side all the time, which is good.
Yeah. Some people, they have a job, some people they have a career, and some people they have a calling, I would imagine that you walk through the day feeling like, hey, I'm making a positive difference in this world.
Yeah.
And you are, for sure. Now, breast augmentation also has a high rate of satisfaction. What I read was 94% of patients are satisfied. Do you see kind of a similar thing?
Oh, absolutely. I would say absolutely, yes. Let's see here. From the breast augmentation, most people think about it. Finally kind of take the leap of faith, go through it. Nowadays, it's not nearly as scary or like guesswork, I say.
Yeah.
A lot of us have 3D imaging softwares where we can take photos of the patient, and then it's kind of like weird science where we plug in the computer. All right, let's put this little implant in, and then kind of see what it looks like, and you can watch it on yourself, on a screen and kind of see those changes and sort of get a a foreshadowing of, hey, what's this really going to look like?
Yeah.
And then trying on size and stuff. So I think through all that, we can nail it pretty close almost every single time. So the, near universal, hey, I'm happy with this thing.
Yeah.
I would totally agree with that.
Yeah. Yeah. That's, and another observation I can make, I treat a lot of patients with breast cancer.
Yeah.
I would say, probably 1% of women love their breasts. That's my guess.
Oh yeah. Yeah.
Like now probably 85 are going to say, I feel okay about my breasts.
Yeah.
They're fine.
Yeah.
But I would say 1% just, I love my breasts. Is that about this, what you'd notice?
I would say, yeah, it's like surgical patients, a lot of women, and you ask them questions about their breasts beforehand in our medical interviews we're doing with them, and same thing, they're like, I don't know, I don't ever look at them.
Yeah, kind of ambivalent, right?
You do run across that a lot.
Yeah. And so, yeah, that's cool. And now, do you ever do any surgeries on men? Do you have which procedures would you say you perform on men the most?
Men. So, kind of like the whole specialty is becoming more and more accepted. I think 20 years ago, plastic surgery was like still a big secret. You didn't want anybody to know about it. It was very hush hush, kind of thing.
Sure.
And in recovery. Now we're in the selfie generation and the self promotion generation and more acceptance of everything. And so that brings in a lot more men who normally wouldn't. So a lot of men coming in for Botox, for fillers, for brow lifts, face lifts. We do a lot of men tummy tucks. Same thing, massive weight loss. Women have a much higher rate of abdominal contouring because of childbearing and muscle stretching and all that abdominal wall stuff. We need to kind of help get them back to where they were, at one point in time. But a lot of men, a lot of weight loss, they want to kind of get back to looking healthy and fit because they've worked so hard they are healthy and fit. You just can't see it.
And just the last place
underneath
it comes
all that
off
skin,
is in the belly a lot of times.
Yes.
And so, it's it's probably more socially acceptable for a man to have a belly. If I have a gut, I don't feel that bad walking around with it sometimes.
Yeah.
And so, which happens from, in the wintertime, you're going to gain a little weight, and it's just part of the deal. And then so the technology that you were talking about that kind of gives people an idea of what they're going to look like in the future, is that an AI-based thing, or is it just a computer-based thing, or does AI have a role in plastic surgery?
There is probably some stuff in the works, and I think our particular program has some that they're working on, but it's more of a not quite into the new AI realm where it's figuring everything out.
Yeah.
It's still more of a
between Photoshop and AI.
Exactly. Somewhere blending those magics. Yeah.
Yeah. It's, that's all the craze. AI. It's going to fix everything. We'll see. It might, but we'll see. And then, what's like a recovery time, let's say for like a breast augmentation?
Sure. It's actually pretty quick. All right. So you could have a breast augmentation and depending on where we put things, but you could easily go to lunch the next day with some friends and be pretty comfortable.
Okay.
A little sore, a little tight. Variables are going to be how big of an implant or how much of an augment you go. Yeah. The more stretch on your tissues, the little more uncomfortable you'll be. But for the vast majority of people, it's about a week of downtime. You're feeling sore, tight. Most women describe, I feel tightness in my chest, like a stretch, more so than pain.
Yeah.
But it's very well managed. It's not a lot. Now we need you to not do too much activity, so we don't
go bench press, right?
Yeah, exactly. Let's hold off on the push-ups and the bench press for a little while. But the recovery is really not too bad. Probably about a week to 10 days of taking it easy, and by a month, you're pretty much doing everything you want to do.
Yeah.
Doc Discussions with Dr. Jason Edwards. Brought to you by St. Luke's, St. Louis.
What about people who overdo it? This body dysmorphic syndrome, is that something you see very often, or dysmorphic disorder, I guess?
Sure. Yeah. Statistically, it's about 7 to maybe 11 or 12% of patients that come into a plastic surgery office in some sort of, variance, I guess, it's somewhere around there. And it is, we definitely see people that come in. I wouldn't say an addiction at all, but it's kind of like a snowball effect to where, I guess I'm kind of jumping to a different little thing. There are some people that, hey, I lost a lot of weight, so let's treat this area first, and then I'm going to plan to. We kind of decide some stages to do it in. You can't do it all at once. A little too much for your body, right? So we'll break it down so it's kind of pre-planned. There are some people that come in that their mind is telling them something looks a certain way, and we don't really see it. So we try to hold their hand and let them know. I know you're feeling this, but I'm going to tell you the vast majority of people aren't seeing what you're seeing, and it's okay. Now, here's what we can do, but we can also not do that, and we'll kind of try to guide them. I wouldn't say it's glaringly obvious, but you can tell when something is not as bad as they think it is, and our job is to help guide them through that.
I think every one of us has distortions in our thinking, and sometimes you can just kind of take it a little too far, or a lot too far. And so it's kind of a nuanced thing, I would assume. And then what do you think, like the Instagram and the face chats and all that, the social media stuff, how do you think that plays into like plastic surgery? Are you seeing some interplay there?
Yeah, well, it's all, well, from that in particular, I would say one thing that we get so many people that come in that are worried about their, like the neck these days. And I think it's more because we're on a selfie generation, we're on our phones, we're doing things. A lot of people will take their selfie picture up high, so it pulls their chin up a little bit, so they don't have that little gap. Any of us look down, we all got extra skin underneath the chin and a little fullness, and everybody tries to find their way to hide that and look the best. So that's I would say a much more common thing we see now, probably related to always being on the phone. Would be one thing. And then two, the filters, unfortunately, kind of misguide everybody on what true beauty is and what the real population is. So we do get a little skewed on thinking, man, everybody looks this good. Why do I not look that good?
Yeah, there's like a selection bias, right?
Correct. Yeah. And that's got to get to. And that's probably one of the most negative aspects of that, of just not realizing that, like you said, everybody's got some flaws, and there's some beauty in that, and some beauty and some asymmetries. And just trying to figure out what's really a problem for you and what can we really fix versus unrealistic filter type, Snapchat expectations.
Are you familiar with this fox eye? This it's like an upturning of the outer canthus of the eye. Yeah. It's I don't know. It's like a thing I saw.
I would assume there's
probably a technical name for that.
Yeah, some famous celebrities, we'll keep names out, that do those. I think a lot of times the particular fox eye I'm not familiar with, but I'm assuming it's probably some sort of thread. Okay. Sometimes a little suture with some barbs on it that can easily be threaded through the tissue just through a little needle hole. So it's not like a major surgery.
Okay, got you.
Dissolvable suture lasts 6 months to a year and a half or something like that, where they can pull some tissue tight quickly in an office.
And then redo it.
It'll hold and pull tight, and then it'll slowly relax over time.
So when the fad passes, you can kind of get back to baseline.
Kind of a quick way to do something. It's can be good. There's a lot of bad that comes with it too. Speak with your medical professional before diving into that.
Yeah, we're doctors, but we're not your doctors, so don't take anything we say as gospel as far as medical advice. And then I've read about 30% of breast implants require a revision within 10 years. Is that old data, or is that relevant?
I think that's more on the old data. Yeah. Let's say, so there is big picture saline implants and silicone implants, and for a while, not to go way deep into the weeds, but silicone implants were pulled off the market from 1992 to 2006 as we studied them to make sure, hey, are these causing health problems? We can't find a correlation with health problems. We still have ongoing studies to try and figure that stuff out because we don't want to do anything wrong. And fortunately, we can't find it related to anything wrong. So
silicone's a relatively inert element.
Yeah, and the body sees it, walls it off, says, I can't eat you up. I'm going to wall you off into a capsule or a scar ball, and that's what holds it in place. And we like that. That's what holds that implant there, and it kind of forgets about it.
Yeah.
During that period of time when it was kind of off the market in America, the rest of the world kept using it, but we used a lot of saline implants.
Yeah.
Still a silicone shell, but we can fill them with salt water. They didn't last quite as long, 8 to 13 years maybe on average. They can slowly leak. They can just pop and then just kind of deflate real quickly. but a very safe implant. When it's leaking because the breast gets smaller or it just goes flat, but they didn't last quite so long. And then the implants before that, the old silicone implants, very thin shells, very kind of oily, thin, oily silicone in there, just because the characteristic of the physics of that implant just didn't last as long. Now we're light years ahead of that. We're in our, fifth, sixth generation of implants, much better technology. Silicone is a lot stronger. It's a solid gel. It's bonded well to the shell. So we're lasting, 25, 35 years now. I can anticipate that a man-made device, it can, be quicker than that. But for the vast majority of people, they're going to last a really long time now, which is great. So, and we, again, can't find any health risks truly associated with them. Still looking into that to try and figure that all out. But.
Yeah. And just, of course, you want to do the studies and follow people over time, but just it makes sense that in a relatively inert element like silicone, the body's just not going to have a lot of reaction to. And
Correct.
Should be safe.
Yeah, I would say it's probably about 0.5% per year rupture risk. So whereas before at 10 years, got to do something with it. At least now, we're talking maybe 5% of them.
Yeah.
And 0.5% are going to be truly ruptured. Now there's other reasons why, size change, life goes on, body changes. I lost weight. We need to do something beforehand.
Sure.
But yeah.
And is that a spontaneous rupture, or is it due to a trauma or car wreck or both? Or
kind of probably a little bit of all the above.
Yeah. You'd think if you ran a lot or something like that, it probably increases your risk a touch. I don't know.
They're pretty robust. We'll we put them to the test in the office to show patients that these are pretty strong. They can take a beating, which is nice.
And so, of course, the Ozempic and the GLP-1 medications, people are losing a lot of weight. What can you talk about what goes into the plastic surgery side of treating those patients?
Sure. So, the first thing is we want to make sure you're a good candidate for that surgery. You've just lost a lot of weight, and whether you're not eating as much or you're exercising more, less calories, whatever, but we want to make sure you lose that weight, or you've had bariatric surgery, let's say, you're taking in less food and you lose a rapid amount of weight pretty quickly. Well, your body's kind of in this breakdown sort of phase. We don't want to jump right into surgery and start making incisions and cuts and sewing things together because you don't really have the protein stores to heal correctly or heal strongly and get nice, good, thin scars and stuff. We don't want you to fall apart. So most people, let's say if you had bariatric surgery, you're going to lose a lot of weight in that first year and then it's going to taper off. And we want you to kind of stabilize for about 6 months, get those protein stores back up, and then we can start working on staging, taking off, what area bugs you the most? Is it your belly that bugs you the most, or your back, or your arms, or your thighs, and figuring out combinations of things that are going to work well together so you can recover and still move and get up and be pretty functional.
And it's skin that you're removing, right?
A lot of skin.
And subcutaneous
skin and fat, yeah. And then in the case of a belly, in case of women with childbearing and whatnot, we're going to tighten those muscles as well. But the vast majority of it is skin and fat that's left over that we got to remove.
Yeah.
For a combination of techniques. So there's, we'll do some liposuction in some areas and suck out some residual fat if it's still bulky in a few areas. Let's say, gosh, we all know, that lower back and flanks, you can work out all you want and have a six pack, but there's still guys at the gym with you got that bulge down there with a tight shirt.
Little pudge.
Yeah.
Little pudge.
So we're there to help out with that. That's okay. With that massive weight loss, it's usually you've burned through all that. You don't have a lot of fat stores left. It's just loose skin.
Yeah.
And we just got to take up gobs of skin and figure out the best ways to hide those scars as inconspicuous as possible. Hide them in clothing and
I've seen them in the medial thighs with some of my patients, and you like if I'm doing like a gyne exam on somebody, I can see it. But other than that, you'd never see it. And so
we've over the years we've got smarter and smarter, and our placement of things has got better. Even probably the arms is probably your most visible area to do a cosmetic surgery.
The upper arm.
The upper arms, yeah. If you've got the saggy kind of bat wings hanging down. But we put those scars low enough and kind of back enough that for the vast majority of your arm and body positions, you're never going to see those scars because they're kind of tucked in on your side. Maybe if you, raise your arm way up in the air, people will notice them. But once they've faded, they're faded pretty well. It's awesome.
Yeah, and you actually rarely raise your arm up in the air.
Yeah. We're not in school anymore.
Yeah.
Yeah, so that's great. And with that one, like all these things, it gives people their life back. A lot of people with like the arms, I can't find shirts that fit. I can't, it depends on every piece of clothing choice is my arms aren't going to fit in that.
Yeah.
And so when you get to that point, the scar is an easy trade-off to get rid of that because your confidence is up, your clothing choices are up, and most people don't care anymore. They've got, they're so happy with that contour. It's just, they got their life back.
Yeah, I recently read that the more self-conscious you are, the higher your rate of depression is. So literally, like the more you're thinking about yourself, the more depressed you're going to be. And I believe that. That checked out when I read it. And if you're worried about a part of your body that you think is very visible, I mean, you're going to be kind of focused on yourself a lot, and that's not good for the mind. And so if you're trying to optimize your quality of life, I mean, it makes a lot of sense to get those things taken care of.
Yeah, I think the old thought maybe of being vain or, doing it for selfish reasons and stuff, just like you said, it's not really that. It really gives you positivity and confidence back, which travels over to your job and to the way you interact with other people and the activities you do, which changes your lifestyle, which keeps you healthier. It's a great little kind of connected circle, a balance of life.
I agree 100%. I think most people would be very surprised and shocked. And I think in some ways, like the Overton window of plastic surgery has shifted in a good direction where it's more acceptable. You're not considered to be totally vain to do it. Yeah. And then the last thing, do you do ab implants? Have you ever done the ab implants?
I don't do any ab implants, let's say, but we do some sculpting on there. If we're doing some liposuction on the abdomen where we can kind of sculpt in some kind of, I don't want to say fake abs, but it's sort of a subtraction thing. You leave a little more fat where you want the abs to be, and you kind of sculpt the lines out around there, and you can give the illusion of a nice little six-pack by doing a little bit of sculpting.
Discounts for like fellow radiation oncologists?
Absolutely.
All right, let's do it, man. Game on. All right, Scott. Hey, thanks so much, buddy. I appreciate you.
Oh, man. Great having me on, Jay. I appreciate it.
Thanks.
Join us next time for Doc Discussions with Dr. Jason Edwards. It's medicine for your body, mind, and spirit.